I'm rolling, so whenever you guys are ready.
Hi, how you doing?
Good. How are you today?
Good, good.
Your name is?
John Dash.
John. I'm Anthony. I'll be your pharmacist
Okay,
today.
nice to meet you.
Nice to meet you. John, before we get started, let me make sure I have the right patient. Can you tell me your month and date of birth?
January 2nd,
And how about your address?
731 North Pond.
All right, perfect. So I'm going to look at your profile, and before we get started, I'm going to ask you some questions that'll help me determine how this medication will work with your current medications,
Okay,
and
sure.
if you have any other, and there'll be some social questions I'll
All
ask
right,
you
yeah,
also.
no, I understand.
Is that okay with
Yep.
you? All right, good. I see that you're on lisinopril 10 milligrams. Is that
Yeah,
so true?
yeah.
And what are you taking that
That's
for?
for my blood pressure. I've been taking it for about 3-4 years, something
Okay.
like that.
Do you have any medication or drug allergies that I should be aware of?
No, no.
Okay. John, if you use any alcohol, how much would you say you consume?
Usually I have like a glass of wine with dinner,
Okay.
and then on the weekend, if I get together with my buddies, we'll have 2 or 3 beers, something like that.
Okay, that's fine. And if you use tobacco, how much tobacco do you consume?
No, I don't smoke anymore. I quit like over 10 years ago.
Well, congratulations on that.
Thanks.
Smoking cessation is one of the best things you can do for your health.
Yeah, I feel a lot better since I haven't.
That's great. I'm sure it helped you with your blood pressure,
Yeah,
too.
yeah.
Do you use any herbal products or over-the-counter products?
I take fish oil and vitamin C
Okay.
and ibuprofen once in a while.
Okay. Were those prescribed by your doctor, or is that something you're just doing for your own health?
Just for my own.
Good.
Yeah. I take the ibuprofen when I get a headache or something like
Sure,
that. Yeah.
sure. John, we ask everybody this question. Do you use any illicit drugs, like marijuana, cocaine?
Oh, no, nothing like that.
All right. Again, we have to ask that to everybody. So I see your doctor's prescribed you some Vicodin, also known as oxycodone,
Yeah.
5 milligrams, and it has some Tylenol or acetaminophen 325 in it. So he's prescribed for you to take 1 to 2 tablets,
Yeah.
3 to 4 times per day. He's prescribed a quantity of 56, and there's no refills on that medication.
Wait. You sure that's not a mistake? I mean, the last time when I had my other knee done, I got a lot more medicine than that. I mean, that's not going to be enough.
Well,
I mean, I go through a lot of pain at night with
Sure.
my knee and after the physical therapy.
well, John, let's talk about that. What's your understanding of this medication?
Well, just supposed to take the pain away, and it does.
Yeah.
Yeah.
And it worked well for you last time.
Yeah. The only one problem I had from it, I get constipated once in a while, a little bit from it, but that was certainly a decent price to pay for
Did
the
he?
results.
Okay. Did he give you any additional instructions in terms of how you could help control your pain during your rehab?
No, not really. No.
Okay. Well, the problem with this medication is that it can be habit-forming, and certainly it can add to some potential for some misuse.
Yeah,
So,
but I don't look like the type that's going to misuse anything like that.
certainly, medication misuse or drug addiction or whatever you want to, what's happening in terms of excessive drug use is certainly not, constrained by economics, social, racial, stature within the community, etc. It's become, and I'm sure you've probably read about it. It's a problem within
I can
our
understand
society.
where you're coming from. Yeah.
Yeah. So what's happened? Can we talk about this a little bit more? So were there any other issues besides the constipation that you were concerned of or were problematic with your last rehab after your knee surgery?
Nah. Sometimes I'd get a little anxiety when I hadn't had one in a while. I'd get a
Okay.
little nervous, shaky.
Nervous. All right. Any other concerns that you had after your rehab?
No.
Okay. And you talked about the constipation
Yeah,
that you had.
yeah.
Okay. Well, let me explain to you some of the background on the new law that's been put into place. It went into effect July 2016, and it was really for new medication prescriptions for acute pain. And what the what we've done, or the legislature has done, is limited that to a 7-day supply. And so that's why the quantity now is 56. That's the maximum amount by the new law that we can, your physician can prescribe for you for an acute pain event, which is basically what you're in that situation now. Do you have any concerns with that in terms of anything additional? They're certainly not meant to, prevent you having access to medication that'll help you with your pain control.
Yeah, I'm just worried about, like, a couple times before when I was taking the other stuff, I maybe took advantage a little bit and, snuck a couple extra ones because, made me feel good.
Yeah, and what's really happening, or what the law is intended to circumvent and prevent or minimize, is maybe misuse or access to quantities of medications that are really people like a vulnerable teenager or maybe another family member who's not been prescribed a medication access because, again, of large quantities of prescription drugs that are in your medicine cabinet. So that's why they put that new limitation on the quantities.
I guess I understand that.
Well, so after your rehab, are there other things that you've considered to help control your medication? I mean, your pain? Sorry.
No, not really.
All right. So maybe we could talk about that a little bit more.
Okay.
And maybe we can discuss some other ways that can help you control your pain after your surgery and after your rehab that would be a little more successful in terms of using your medication properly. How's that sound?
I'm willing to listen.
Okay. Okay, John, so again, we don't want the same thing to happen to you as happened last time. And so let's just discuss some additional options and see if we can come up with a plan.
Alrighty.
And we'll talk about maybe a way to make you more comfortable and maybe more successful. Okay, John, based on what we discussed, what additional things are you going to do this time around to help you manage your rehab and your pain?
Well, I'm going to start out taking one pill and see if that'll work for a half hour, 45 minutes or so. And if it doesn't, take another one.
Okay.
And definitely not take more than my limit of 8 in one day.
Great, great.
And then you mentioned something about taking a stool softener and that I should make an attempt to drink a lot more water than that.
So you want to take your stool softener at least, 1 to 3 times a day while you're taking your Vicodin, and making sure you take your medication with a full glass of water.
Okay. Yeah. And then you suggested I may try the ibuprofen a little bit.
Right.
And maybe some ice packs, like when I'm sitting watching TV or something.
Great. So again, after you're, instead of taking that additional Vicodin that you did last time, substitute 1 to 2 more ibuprofen.
Okay.
That'd be a great option. And again, use as much ice as you need
All right.
to help you with the pain. What other things, anything else that you talked about that you're going to consider this time around?
No, not that I can think of.
All right, no, I think we have a plan.
Yeah.
And so, John, what I'd like to do is give you a call within the week. You're going to come back probably anyway.
Yeah, because I only got 7 days. I'm definitely going to see you or the doctor.
But when you come in the next time, let's talk about and see how you're doing. And again, if you have any concerns in between now and then, certainly give your doctor a call.
Okay.
And I'll also update him to tell him about what we talked about. How's that sound?
All right. No, sounds good. Sounds
right.
like a plan.
All right, great, John.
All right.
Good luck with your
All right,
rehab.
nice meeting
Thank
you.
you.